Hi, my name is Madeleine Nimerala, and today I'll be presenting my research on the societal and personal impacts of GLP-1 RA weight loss medications. Before I get into my presentation, here's a little bit about me. I'm a rising senior at Yorktown High School in Arlington, Virginia. I'm an intern for a nationwide nonprofit organization called Brighter Bites. I work with a program called Inova Healthy Plate Club. I'm a lead coordinator of a community garden initiative, and I'm on my school's varsity field hockey team. My interests include global health, nutrition, and medicine. Firstly, I want to explain what GLP-1 RAs are and how they work. GLP-1 RAs, or glucagon-like peptide 1 receptor agonists, are a type of medication that mimic a natural hormone in the body called GLP-1, or glucagon-like peptide 1. This hormone is normally released in response to eating and helps regulate blood sugar levels. This diagram illustrates mechanisms of GLP-1 receptor agonists, medications. GLP-1 RAs act on multiple organs to support blood sugar regulation and weight loss. In the brain, they increase satiety and decrease appetite, helping reduce food intake. In the stomach, they slow gastric emptying and increase acid secretion, which contributes to prolonged fullness and delayed nutrient absorption. In the pancreas, they boost insulin secretion while suppressing glucagon production, leading to improved blood glucose control. They also promote glucose uptake and fat breakdown in adipose tissue, enhance glucose uptake and glycogen synthesis in muscle, and reduce fat buildup and glucose production in the liver. Additionally, GLP-1 RAs offer cardioprotective benefits. Together, these effects make GLP-1 RAs powerful tools for managing type 2 diabetes, obesity, and related metabolic conditions. GLP-1 RA medications have been proposed as a promising solution for those struggling to lose weight. As rates of obesity and type 2 diabetes continue to rise worldwide, straining healthcare systems and disproportionately affecting low-income and marginalized populations, GLP-1 RAs have emerged as a powerful tool in public health strategies aimed at preventing chronic illness, improving quality of life, and reducing long-term healthcare costs on a global scale. However, the rise in popularity of GLP-1 RA weight loss drugs has prompted questions about the safety, efficacy, and personal impacts. My research aims to explore the potential outcomes of the widespread use of GLP-1 RA weight loss drugs through the exploration of patient experiences. I chose to do a phenomenological study because it allows for an in-depth exploration of people's lived experiences. I conducted 15 to 20-minute interviews with 5 participants who have all been taking GLP-1 RA medications for 6 months or more and have lost at least 15 pounds. All participants were aged 40 to 60. I also want to acknowledge some limitations to my research. The findings may not apply to the broader population of people using a GLP-1 RA due to the small sample size, variability in participants, and non-random sampling. Despite these limitations, my research still offers valuable insights into how GLP-1 RA medications impact mental and physical health. Through my interviews, I identified 5 key themes. Overall, I found that patients experienced a change in their energy levels, a change in their physical activity, no change in their social activity, a change in their mental well-being, and no change or a negative change in their nutrition. The first theme that emerged from my interviews was an overall increase in energy and vitality among patients taking these medications. Participant 1 shared that on Zepbound, I feel not energized, but I feel upbeat for some reason. This highlights that even if physical energy didn't always dramatically improve, many patients experienced a lift in their mood and outlook. And participant 2 remarked that it might be a little better with the Mounjaro, actually, suggesting that they noticed a slight positive change in their energy after switching medications. Overall, these responses showed that while the medications don't always create a huge surge in physical energy, many patients felt some kind of emotional or motivational boost that contributed to a better sense of well-being. Another key theme that emerged was changes in physical activity levels after starting the medication. Participant 1 shared that when you're heavy, it's harder to work out. I'm working out 6 times a week now, so I guess I'm exercising a lot more. While participant 3 stated, I wasn't really doing any physical exercise, so probably a combination of just losing enough weight where I could do it and having more time in my day to allow for it. These quotes show that as patients lost weight, physical activity became more accessible and consistent, suggesting that these medications may indirectly encourage healthier behaviors by removing some physical barriers to exercise. Both also acknowledged that having time in their day to exercise also contributed to an increase in their exercise. I also explored whether social activity changed after patients began taking these medications. Participant 1 explained that their social life stayed about the same, saying, "I think my social life has always been the same. I don't notice a difference." They explained that if they were in a different life stage, suppose if they were dating, they would feel more motivated to go out more because they have a better self-image. Participant 3 makes a powerful statement saying, "I'm not the big elephant in the room anymore." This shows that even if social behaviors didn't change dramatically, feelings of confidence and social perception did shift. Overall, I noticed that changes in social activity were less about the medication itself and more connected to where participants were in their personal lives. Another theme I identified was improvement in mental well-being. Participants shared that after losing weight with the medication, they experienced noticeable boosts in their mood and confidence. Participant 1 said, "Yes, I feel more positive even amidst everything that's happening in the world. I'm pretty positive." While participant 3 shared that it definitely eases social anxiety. How are people judging me and stuff like that. Overall, while these medications primarily target physical health, participants described real emotional benefits as well. When I asked participants about their nutrition habits, most reported little to no improvement and in some cases, even a negative change. Participant 1 stated that, "I've always had really good eating habits. I don't binge, but I'm not perfect. I still eat everything I normally would, I just eat in less quantities." While participant 3 actually noted a decline in food quality. It actually probably has a negative impact on the types of foods I put in my body. So because I know that my body is digesting things, I'm not as strict about it. Overall, the medication alone did not necessarily lead to healthier eating habits for everyone. Addressing global health issues like the obesity crisis requires a multifaceted approach that includes expanding access to GLP-1 RA medications, integrating these treatments into national health systems, advocating for broader insurance coverage, and offering them through community-based clinics can reduce financial and structural barriers, particularly for underserved communities. To make a meaningful impact, collaboration among healthcare providers, policymakers, public health officials, and local communities is essential. By combining clinical innovation with equitable access strategies, GLP-1 RAs can become a key component in reducing the global burden of obesity and related chronic diseases. These are my references. Thank you for listening to my presentation, and thank you to the Global Health Leaders Conference at Johns Hopkins for this opportunity.